just as in any other field, people need their recovery time. And for your physician to be maximally effective and maximally able to listen, to empathize, to make clear decisions, to make timely decisions, they need to be well themselves. And part of that is that they need to be rested. Part of that is that we don't want them to have undue amounts of distress. And so we've been interested in looking at both fatigue and distress to learn more about what are the actual impacts of those potential negatives on patients and physicians. Residents reported a fairly high level of having difficulties with motor vehicle incidents. More than half of the residents in our study over the course of their training reported at least having a near-miss sort of motor vehicle accident, and just over 10% said they'd actually been in a car crash during their residency. So that told us that, okay, these residents are, they're driving, they're using their motor vehicles. The follow-up to that was, okay, is that associated with them being tired? Is that associated with them being burned out? And we expected to find associations with fatigue. There's been previous literature, and it makes sense. If you're tired, especially if you're excessively tired, you should be more likely to get into car crashes. That's true whether you're a physician or someone working in any other field, or someone who's been up all night with a crying baby at home. It doesn't matter what the cause is. And so we were able to confirm that. In our data, fatigue was strongly associated with the residents telling us, yeah, I had a car problem. But what had never been looked at before was, well, what about if they're distressed, or they're burned out, or they're depressed? Is that associated with car crashes or near misses? And we weren't sure what we would find there. But what we did find was effects and associations that were as strong as the associations of car crashes with fatigue. So burnout, depression, distress, those issues contributed and seemed to lead to increased risk of being involved in near misses or car crashes. And what we've been trying to do with our work is continue to focus attention on the issues with the idea that what I'll call the old school approach to training, which is sort of simplistically, we put you in residency on day one, and then depending on what program you're in, 3 years, 5 years, 10 years later, after being essentially sleep deprived intermittently for that length of time, that you graduate as a skilled, independent physician. And what we're trying to focus attention on is there are dramatically successful aspects of that traditional approach to training, but there are risks as well. And we need updated curricular approaches, updated training approaches that retain all of the educational benefits. We need to still train the best physicians in the world. That can't change. But are there ways we can continue to train physicians to that goal that at the same time minimize the level of distress, the level of fatigue? All of these things that we're beginning to learn have adverse consequences on physicians themselves, patients, and others they may come into contact to. So that's really what we're trying to promote in our work, is continued attention to maximizing the benefits of our training programs and minimizing the risks.